There we go. Sorry about that.
Yeah, I tried many times, a couple of times to, it didn't get the send request. I press it and then it never went to you, or I'm not sure
I
what happened.
apologize. I think that was me. I had to update the actual.
Oh,
Sorry about that.
no problem.
So, yeah. So, how you doing? It's been a couple of weeks.
I know, my condolences. I'm so
Oh,
sorry.
yeah. Thank you so much.
And Lola was 100, I believe.
Yeah, 101, and you were part of the 101 birthday.
Birthday
So, thank you very much.
celebration.
She saw
Yeah.
that, and she really appreciated it.
Oh,
So,
I think I did a little shout out video for her, I think.
yeah, you did. So, she really
Yeah.
loved that.
Oh, good.
So,
Good,
yeah. So,
good.
thanks
That's
so much.
great.
So let's get to the questions. The question that everybody's asking: will stage two open up before Canada Day so I can get my haircut?
Right. I like to get my hair done too.
Yeah.
Um, You get your hair cut. Funny guy. So the good news is everything will open July 2nd, which is 10 days away, less than about 10 days. I think they're looking closely at personal care providers, which are hair, nail salons, estheticians, tattoo parlors, etc., spas, uh, opening a little early. It's, it is possible we got a Thursday or a Friday announcement for the month for Monday. It might be tough for some of them because I know they're all, restocking and rehiring and training staff and getting prepared to open. Um, and, the bottom line is let this be the last lockdown. So take the time we need to get it right so that we get it right and we don't close down only to have to close down and reopen again. So I know we always need 2 weeks of data, right? And we had the openings 2 weeks ago.
Yeah.
On Friday will be the 2 week anniversary of the outdoor patios and the retail at 15% capacity opening. And we know that it takes 7 to 14 days before we start seeing any impact of what the reopening had. So I know that's what they're closely monitoring, right? And the numbers are good. We only had 10 new cases in Mississauga today.
That's amazing.
And
So
10 and 10 in Brampton too. So that's really amazing.
that is 20 in. No, wait. How much did Caledon get? Do you know?
One and
Well,
one
okay,
pending, so it was
21.
like 22. Yeah,
Lucky
so
21.
really good.
Okay.
So very, very, very good numbers. And may I just say that the hospitals are doing very well. I think there are very few people, I want to say 5 in the ICU, and about 20 patients with COVID, but COVID symptoms that are recovering, and very few active cases. I think Trillium Health Partners only had, I think it was like one person come in over the weekend. So it's just fantastic what's happening. We're seeing the results of everybody's hard work to do their part in this pandemic. I really want to thank everyone because we all made an effort. Some bigger, some smaller, but we all made an effort, and every little bit mattered and every little bit counted to get us here to this point. And what's really truly made the difference, of course, is the vaccinations, right? And I'm sure you want to talk about the vaccines, but we have 75%, more than 75% of 18 plus with first doses. And I
Yeah.
will tell you, our 12 to 17-year-olds have really stepped up. That just tells me they want to go back to the classroom in the fall. That's what that tells me. They
Yeah,
are
you're right.
60% vaccinated. 12 to 17-year-olds, 60%. And the
So, okay.
Pfizer, and hang on, the Pfizer that is remaining, and we can talk about the fact that we got 9 million, a shipment of 9 million doses of Moderna, and whatever Pfizer is remaining is actually being kept on hand for the 12 to 17-year-olds, because that is the only vaccine that is been deemed safe for them, and the others aren't approved yet. So the has been saved or set aside for the younger people, younger adults, and everybody's been encouraged to get Moderna because they are bio identical and interchangeable. They're basically the same formula that's used. They're both mRNAs and they're both interchangeable. So we're encouraging everyone to get vaccinated, get the first vaccine, and you'll have a choice again next year because there's a very strong possibility we'll have to have booster shots next year. So don't worry about it. If you got Pfizer, go get a Moderna. There's less AstraZeneca in the system as well. Mm-hmm.
Let me ask you this because this is a viewer question. A lot of the viewer questions were about Pfizer and Moderna. Will Pfizer be available next week at the Max Vaccination
No,
Clinic?
No, we're not seeing it again arrive until mid-July. So it won't be
Oh,
until at
really?
least the second or third week in July, probably the third week in July, that we'll get more Pfizer. Now, that's nobody's fault. It is a production issue at Pfizer that they are retooling and ramping up their production. They're rescaling their production. So it's on the delay is on their side, which
Okay.
has happened before. It has happened before to both Moderna and Pfizer. Pfizer ramped up once before, and this is the second time. So it's the fault is not the fault, but the problem. The delay is on their end, but that's fine. We have lots of Moderna available right now, and less AstraZeneca. And frankly, you know that many people are considering getting an mRNA that took the first dose AstraZeneca. What are you going to do, Khaled?
I already did.
You
I
did.
did
You
it
got the
on,
Moderna?
yeah,
Sorry,
no, I got
the
the
Pfizer.
Pfizer on Saturday. So I did the AstraZeneca Pfizer
And then
cocktail.
you did the
Yeah.
cocktail. Where did you
Yeah.
get your Pfizer?
At the IDA in Streetsville.
Okay, because
Yeah.
people email me and text me all the time. Where can I get Pfizer? I want a second dose of Pfizer. So
Well,
that's good to know.
yeah. Well, they also have 500 people in the backlog. So they I
Well,
was
well, I'm glad you got your first choice. That's nice. But
yeah.
okay, I'll tell my kids all got Moderna, and they're happy they got it. And well, my kids are 30s and 20-year-olds, but and they were very pleased to get the Moderna, no problem. We know that Dr. Lawrence Lowe got Moderna, and we know
Yeah.
that Dolly Parton got Moderna, and Dr. Fauci in the
Okay.
US got Moderna. So
Well,
everyone's getting Moderna.
so let me ask, there is Moderna hesitancy. I hate to say it, but there is, right? Because everybody's asking for Pfizer this, Pfizer that. What do you have to say to people? Like, have you seen cancellations this week because
There have
Moderna's?
been right, but only with those people. The hesitancy is only because they had Pfizer and they weren't sure if they should mix, and we're
Correct.
just assuring them that it's fine, that they can absolutely take either of them and combine, because both are mRNAs. And if you can take an AstraZeneca and then an mRNA, why can't you take two mRNAs, right? So a little bit, not as much as you would think, a little bit. And then the one I heard was anecdotally, they felt there were more side effects with Moderna. And, I've heard people side effects with both, or
Yeah.
I was very fortunate. I didn't even have a sore arm. I did a weight class the next morning. I
Well, I'll talk
didn't.
about that. Talk to you about that later. So just remember as Mr. NA, just Mr.
Ah,
NA. There you go. Okay.
that's right. mRNA. Well, I know
Yeah.
DNA and RNA. This is
Yeah. Yeah.
RNA.
Sure. Utah got the shot, and
Hey,
he's in the 12 to 17 bracket,
so he's the
right?
Pfizer.
But his next shot is not until October. Are they going to speed that up?
I'm quite sure they will. I'm
Yeah.
quite sure they will. Yeah, it's all dependent on supply and allocation was always the issue. So it's supply issue right now. They will. As
Okay.
soon as we get more supply, those appointments get moved up. You're in the system. You'll be called.
Okay. Perfect.
Mom and I were called. Everyone's getting called. I
Okay.
track all my friends. When was your first dose? Did you book your second dose? Have you gotten it yet? What'd you get? Any side effects? We're all sharing information. So we have all this anecdotal information from my expanded group.
Yeah. No, I got asked about 50 questions from 50 different people about the AZ Pfizer cocktail. Told them it was fine. So just felt a little rough the
Did you
next day.
have did you have fever,
I
or
didn't have a fever. I just felt my
you're just
body. I had
lethargic,
body ache.
body ache, and you're tired?
Yeah.
That's what I hear most of all, that people are very tired,
Yeah.
and I'll share that my kids had fever for
Oh,
two days. Yeah, 2 days with fever.
when
And
your kid, when your kids did ask a question that I'll ask later. So,
oh, is that going to be who's your favorite child again?
oh, well, yes. We'll talk about that later. Okay. So, here's a viewer's question. So, do fully vaccinated people still have to wear masks? And obviously they do.
Yes, they do, until we get further guidelines. Yes, please do,
Okay.
in
Till
public
September,
places.
right? That's the
In
bylaw? No?
I think it was December. I think we moved it to
September.
December.
Okay.
But there may be new guidelines once everyone's vaccinated. But right now, the guidelines still remain that you must wear your mask. Yes.
Okay. Perfect. Who can get vaccinated right now?
Anyone who received their first dose had AstraZeneca,
Yeah.
as their first dose, or anybody who had their first dose between, I think it's March 8th and May 8th or May 9th,
Yeah.
right? So if you had your first dose in that time frame, then you're eligible.
Okay. And
And
they could
and of
book it
course,
out.
and of course, anyone who is in, all the special categories like having underlying health issues, or I'm sure all the healthcare workers have already received their vaccine. But there's those criteria of people. If you hit one of those boxes, you're eligible anytime.
Okay. So we're going to talk about tickets now, but I heard that one place got 3 summons. A restaurant got 3 summons. Did you hear about this? Do you have those notes?
I
And I
do.
just want to know why, because I don't think anybody's gotten 3 summons.
Well, yes, they did. A part three summons.
Oh, part 3
Part
summons.
three summons, a part three summons. So that's the more dramatic one. They must have been operating indoors and shouldn't have been, so that they were breaking the Reopening Ontario Act. That's what
Okay.
that is. That's what that is. So they were operating when they weren't permitted to. So it's
And
one thing to get,
you
pardon?
can't tell us the restaurant, eh?
Oh, actually, I don't even know. They don't tell me that. They just say business restaurant, business restaurant. Sometimes they tell me anecdotally, like they tell me one-on-one, but I'm not allowed to say.
Okay.
I have a gas. Okay, let me tell you what I got. I didn't get too many. I did. Mississaugans are really great. Private residence gathering on the Friday, and on the Saturday gathering in a hotel room, believe it or not. And so that, that's complaint based. So one of
Yeah.
the people down the hall heard all the noise and complained. A restaurant was a ticket, and the one, I don't know if it's the same restaurant or a different restaurant, but then I have business restaurant, one part 3 summons. So they got into a lot of trouble. And then the security highlights, they had 13 incidents involving 337 people. Just the gatherings were too large. So people
Okay.
playing, large groups playing basketball, large group doing martial arts, large group exercising, too large a group soccer. Remember, it's still 10 people outside until the July 2nd. Then that expands. So large wedding party gathered. Oh, I hate to hear that. Large group. Imagine getting a ticket on your
Can you
wedding.
imagine
Oh.
that? Your
So,
wedding.
but these are security highlights. So this just means they were educated and informed.
Okay.
Nobody got a ticket, thankfully. And then just cricket, soccer, basketball. Too many people gathering.
Can you imagine being the bylaw officer there and educating the bride and groom?
Right? How, and then the mayor would be calling saying, "You gave a bride a ticket on her wedding? Come on."
True. So, okay, this question is pretty inside baseball. This is from one of our writers, so I'm going to read it to you. General Committee is going to deal with a report tomorrow that deals at the need of office space in the city center. Essentially, it appears that there's too many condos downtown and not enough jobs to sustain that population. Is the city official plan indicates that this should not happen? How come this is happening?
Well, what's happening is that developers buy a piece of property and then apply to rezone it. And of course, residential is much more lucrative for them, right? They make a lot more money on building condominiums and selling, each condominium than they do in an office tower, and either leasing it out or condominiumizing it. So it's very difficult to incentivize the building of office space, office employment. And so that's what we're looking at tomorrow, doing an incentive program. And I can't prejudge on what the council will decide to do, but I hope they'll do the right thing. I know that downtown Toronto was built on CIPs, community improvement plans, or using different structural tools like the TIGs that are being recommended, where we do grant based on the tax increments, right? Of the value that's created in building the employment, and they get a little bit of a break over a period of 10 years. For building, so we incentivize them basically for building employment, which is needed, as your writers inside baseball have indicated. We're losing employment zones, office towers and office space to residential, because of course, when a developer purchases a piece of land, that's what they want to build, right? It makes them most lucrative for them, most profitable.
Let me ask you, remember pre-pandemic, Oxford Square One, they unveiled this amazing kind of cityscape.
30 towers.
Yeah.
30 towers, but some of them were office towers.
Yeah,
and
they
so
were.
that's what we're discussing tomorrow.
Okay.
This grant program through TIGs tax increments, okay, to incentivize the building of that office tower. So I'm very hopeful that council will agree to do that. Sometimes you do have to incentivize them, otherwise they're going to build just res. And there are other places in the city where we should look at it as well. We don't want to lose office employment. And I know downtown Toronto was built on these kind of incentives. So when you look at the buildings like the TD Towers, those black towers, those were all incentivized. Those were all incentivized. So, you know, it's a time in our history where we've grown certain maturity, and I can't lose employment land to speculators who just want to buy up a piece of property and put, you know, something that has the highest payout to themselves on it. We have to be very strategic in what we need, what our city's needs, and our city needs are to ensure that we have office employment land. So we may have to incentivize that, and that's the discussion that we will have tomorrow.
So tomorrow's vote or discussion can have a big impact on the skyline that we see in Mississauga over 20, 30 years?
So, well, yes and no. I mean, I think we're going to vote on using the mechanism, but it's general committee, so it'll get passed at council the following week, right? But so you will still see a tower, but instead of being a residential condominium, it'll be an office building, right?
Okay.
So I'm not sure it'll impact that differently. It'll just be the use that's different.
Okay. And I know, has the province responded to Mississauga's call to have more power over future cannabis stores? I know you guys were talking about that last week.
Right. So 1 week is not sufficient time to have them react. It's, you know, we've asked for a pilot project. I'll be honest, I don't even think I've signed that letter yet. So yeah, we have to draft the letter and get it out to them, and then we wait for a response, and it'll be some time, and then I have to call them and remind them to get me a response. Remember us?
Yeah.
It's interesting actually, because I see a lot of the comments on Instagram about, oh, so you don't want the additional revenue that all these cannabis stores will bring. Well, the point is I want to be able to sell a legal product in a legal manner and de-incentivize the black market and the gray market and deliver a safe product for the people who want to purchase it. But the extra revenue doesn't exist for cities. I will get a business license permit out of it and their business taxes. I don't get excise revenue from the government of Ontario or the federal government. There is not additional income for me or revenue from cannabis.
Okay.
So
and just
that's a misnomer. That doesn't exist for us. There was initially some transition funding to help with policing issues or mental health issues, or there was transitioning money available, but we didn't receive it because we didn't opt in.
Just for the record, you voted yes, right?
I voted yes. The vote was 8-4. The people who voted yes were Councillor Karen Ross, Councillor Stu McFadden, myself, and Councillor Matt Mahoney.
Okay. Oh, 8-4, like only 4 people voted yes? Oh, wow. Okay.
And I need 7 because 6 is a tie and it fails.
Okay.
So we have a long way to go to get 3 more votes.
Yeah. I think a lot of people just think when they see no, they blame you. And they don't realize, it's a vote.
Yeah, well, they have to realize that everyone votes their own conscience. I don't control the vote, and I am only one vote. And so we may have a great idea, but there may be councillors who disagree, and it fails. And this one failed, and this is the second time. And it did remind me of the Uber taxi battle, right? We lost that a few times too. First, before we did it in a pilot program first, right? And then we studied it and realized, yes, there was an impact on the taxi market, but it actually expanded the market, and the people using Uber were different than the people using taxis. And we just needed to deregulate the taxis a little more and allow them to compete. So I'm sort of hopeful that, we've now brought it back twice. I wouldn't bring it back till after the next election because, we have the same council. They probably have the same views. But at the same time, we do have legitimate issues. And the legitimate issues are that we wanted control over zoning and over sensitive use. And that's just more than schools. It's daycares, it's community centers, it's drop-in centers, it's group homes. So there's a lot of sensitive use we didn't want it near, and we didn't want a concentration of them. I didn't want to see, or my councillors didn't want to see 10 stores in Port Credit or 10 in Streetsville. They wanted, if they could be better distributed through the city. but we don't have that kind of control. And that's what we said, well, let's do a pilot project and ask the Premier if he'll allow us to pilot more zoning opportunity, more control over the zoning. All right,
Sure.
so we're waiting to hear. I've watched the example in other municipalities, and quite frankly, I don't think any of them have suffered any of those issues. There hasn't really been a concentration, and I'm not even sure a concentration at the end of the day is a bad thing. Like when you have choice, you know, you have car dealerships that are all lined up together, and then you have choice, because I think these retail outlets sell different products.
True. So I might have Doug next week, so I will ask him directly if he's read your letter.
Okay, perfect. Okay. And if he says, "Oh, I get so many letters," tell him it's that Mississauga would like to opt in and retail cannabis, but we just want a little more control over where those retail stores will go and how many will go. So there's a zoning issue for us. It's not a moral issue. It's a legitimate business. And frankly, you know, I voted in favor because I haven't seen serious issues occur in other municipalities where they do retail cannabis, and it's a legal product. And you know, I feel for people who use the product. I do not, but I'm not making a judgment. People do use CBD oil too, right? And so.
True. Okay. I will tell him in detail. Okay, let's get to some happier stuff here. Well, sure. I guess weed is happy, but I mean, Celebration Square this year.
I know, I tried. I saw that you saw it, and I tried.
Thank you so much.
I even mentioned Utah.
You gave him so much street cred. You sent it to all his friends, and like, anyways, you made him.
Utah wants to watch movies, so we're not there yet, right? We're not there yet, but we're getting there. We're getting there. You know, maybe in the fall we'll be doing something. They have no plans for the isolation circles or whatever we call those crop circles.
Yeah. Okay. And then, so I know that, well, I don't know for sure, but I think New Year's Eve will probably be the first major event.
I think so. I'm feeling fairly confident about that as well. I'm feeling hopeful.
So if you had a choice, because I'm sure the bands are going to be going really fast, what band would you like, or artist would you like to see at Celebration Square on New Year's Eve? I'm putting you on the spot.
Triumph.
Okay.
Triumph, come on! They're local, homegrown. They're amazing citizens of Mississauga.
True. That will definitely gear towards a different demographic.
Well, what would you like me to say? U2 and the Rolling Stones. Those are the bands I listen to.
Well, that'd be great. Let's try it. So, anyway,
we have so much talent here. Like, there's unlimited opportunity and options of local talent that could perform. You know.
True. Billy Talent.
Well, like I live in the south end of the city, and of course Tom Barlow lives down here. I love listening to Tom perform, and he brings Gracie, and he does.
Why don't we do the Best of Mississauga?
Let's do that. That's a great idea. Best of Mississauga. Let all our local homegrown bands perform a set or a couple of numbers. Wouldn't that be great?
Book them now, though. Book them now, because they're going to be. New Year's Eve is going to be a hot ticket. Anyways, okay. So let's get to some of your viewers' questions here. The gas leak near Mississauga Road in Dundas. Any update on that?
Yes, it was resolved early this morning, and actually it affected Councillor Ron Starr directly. He was evacuated. Oh,
he lives, but okay.
He lives on Blythe. I shouldn't say that, but he lives in that area.
I've been to his house actually.
Yes,
so
because
really
we all have for the stars on the credit, right? We've all been there. So that it was right in front of his house, in fact. And it was a gas leak, and it was capped, but of course they cut the gas and they cut the power as well, which makes sense. And you know, my former home, my kids live not far away, and my son was supposed to have dinner with me, and because the power was cut, he couldn't get the garage door open and the car out. Well done to the teams at Enbridge, and of course our firefighters were out all night long assisting, and they did an amazing evacuation of almost 30 homes. So we thank them for their dedications and their patience, because of course this is very fragile work, and you know, could have gone very badly. So we're very thankful that everything went smoothly and everyone was safely evacuated, and this morning everyone returned to their homes. So I'm very grateful. I sent the chief a note just to thank her and the work that her teams did.
Okay. Awesome. Another viewer question. Update on the new Churchill Meadows Community Center. Will outdoor areas be open?
Will outdoor areas be open? Oh, well,
At the Churchill Meadowville Community
I
Center?
don't. So it's the community center itself hasn't been opened yet. Is the whole property fenced off? I'm not aware of that. That's the case.
I don't know. It's just just a question. It sounds like the outdoor area around the new
That's what
community
it
center.
sounds like. I
Yeah.
haven't I haven't been by there in quite a few months. So if
Okay.
it's been fenced off, I'm not sure. It's not open yet, but it's near completion. You know, it won't be long. Won't be long.
Okay. Last question. Who is your favorite child and why? That's harder than the question I ask you every week. What's your favorite restaurant? So.
I know, right? Athena is my newest favorite child.
Okay. Oh, is that your dog?
Yes.
Yeah. Okay. Good answer. Okay.
Well,
All
it's
right.
actually, in fairness, it's my son Alex's dog. It's my grand puppy.
Okay.
It's my grand puppy, but she is a beauty. She's a beauty. Of course, you know that we lost Adonis after only 7 years, and he was such a lovely dog. Oh, we loved that dog, and he used to run with me until he stopped and didn't feel like going any further. But that's another topic. But she's a beauty. She's part German Shepherd and part, what is she, the other part? Oh, Husky, I think. She's just so beautiful. And she's so friendly. And yeah.
So that's your answer, right?
She's smart, Athena.
Yeah. Okay. And last question. How do you feel after your F45 workout, your outdoor workout?
I did it this morning and I did it on the weekend. I signed up for tomorrow too. You know what? It's so necessary. I encourage everyone to be sure they get out and get some exercise, get some fitness, join a fitness class if you possibly can. We've been doing them in the parking lot, which isn't ideal, especially when it rains. But you know what? It's just so important. It's a great stress relief. It releases tension and physical fitness as well. So I'm really excited. I'm so glad that I started doing those classes and started doing hiking in my free time as well. And it's been a godsend for me, honestly, for my mental health and fitness and my well-being.
Are you sore from the F45?
No.
You're fine? Okay. All right. Okay. Those are my questions. It's 5. I'll see you next week.
Yeah. Yeah. Oh, we're going to talk about symptoms, side effects of the different vaccines. Remember, I didn't have any side effects. You said you were just a bit fatigued. Remember? Yeah.
So if you're going to get a Pfizer, if you're getting the next shot, Moderna, Pfizer, same thing.
You'll have to wait. You'll have to wait for Pfizer. I encourage everyone to go get a Moderna. If you're on the list to get vaccinated, if it's your time to get your second dose, get it. Get it. We have to build. We're only 20% fully dosed, fully vaccinated. Only 20% and climbing. So we're 70, let's call it 76, 77%, 18 plus, 60%, 12 to 17. Those kids came on gang boomers to get their shots. And now we got to get the second doses up because one dose is not effective against the Delta variant. You have to get 2. So please encourage everyone out to go get their second dose. Okay.
I am. So thank you so much. I'll catch you next week.
Thank you very much.
Bye.